Hello everybody. We are Andrea Pezzi, orthopedics resident from Italy.
It's F. Levantaras, orthopedic spine surgeon from Denmark.
I am Dr. Guna, orthopedic spine surgeon from India.
Welcome to the Expert Insight series where we interview worldwide expert spine surgeon. And in this interview, we are honored to be joined by Professor Frank Kandziora, world-renowned spine surgeon and head of the Department of Spinal Surgery and Neurotraumatology at BJU Frankfurt am Main since 2008. The center is honored to be AO Spine for excellent quality, and the center also occupies an outstanding position among German spine centers, having received awards from both the German and the European Spine Society.
Professor Kandziora is involved in several professional societies on a voluntary basis and was, among other things, president of the German Spine Society and as well as the European Spine Society, and also a leader for expert groups in AO Spine. He has received numerous scientific awards and was most recently awarded for the AO Technical Commission 2021 for the Innovation Prize.
And Professor Kandziora has also published more than 200 scientific papers and is a guest speaker at many international conferences. He is also an editor, section editor at various renowned scientific journals. Good evening, Professor Kandziora. Thank you for accepting our invitation.
My pleasure.
How are you doing today?
I'm great today. Looking at so many nice people, I'm really great.
Thank you.
Thank you so much, Professor. Let's start our interview, Professor. Yeah.
Okay.
To begin with, for the audience, can you please tell us your full name, your specialty, and your current position, please?
Of course. So my name is Frank Kandziora. I'm from Frankfurt in Germany. I'm a trained general surgeon. I'm trained trauma surgeon, and I'm trained orthopedic surgeon. So I had a couple of trainings in my lifetime. I'm currently head of the department of the Center of Spinal Surgery and Neurotraumatology in Frankfurt at the BJU Hospital, which is a multidisciplinary group working on spine and brain trauma exclusively.
Great. Yeah. So could you share a bit about your roots and your hometown? That I think that is Frankfurt, but
in fact, it isn't. It's now. But I grew up in a very, very small village in Bavaria, which is approximately 80 kilometers away from Munich. And it's a very rural area. So it's just about 2,000 people living there. A very small village, much more cows there than people. So I grew up in this area and I went to school just around the corner in Munich at some part of my lifetime. So in fact, I was growing up in Bavaria.
Great.
We would like to know. You told us you have been trained for several specialties, but we would like to know is when did you train and when did you complete your residency? We don't want to reveal your age, but we would like to know about
So the age is not a big secret, you know. If you look online, you will find it out very quickly. So I'm 55 years old at the moment. So in fact, I studied medicine in Frankfurt. So I wanted to leave the small town. And so Frankfurt is one of the big cities here in Germany. And so I wanted to go to a bigger city. So I studied medicine in Frankfurt. And in fact, after my training, I first started my education, I would say, in the orthopedic department because my medical thesis was in orthopedics. And so I started in orthopedics. And at that time, it was necessary and mandatory to do some general surgical training to become an orthopedic in German. And so I went to Berlin, to Charité University Hospital for general surgical training. And I did a lot of liver surgery and participating in transplantation of big organs and so on. But that wasn't so super interesting. So I moved from the general surgery to trauma surgery. However, it was absolutely mandatory to first become a general surgeon before you became a trauma surgeon. So I first became general surgeon, then I became trauma surgeon, and finally I moved to orthopedics and become orthopedic surgeon. Overall, I finished the general surgery. I finished 2001, the trauma surgery 2 years later, and the orthopedics another 2 years later. So overall, finished 2005 with everything.
Yeah.
Long training, gentlemen. Long
Yeah,
training.
that's a brief introduction about you, Professor. Just continuing with that, how did you get your interest in spine surgery, and why did you choose spine surgery? And what are the things you wish to tell to spine surgeons? What are the pros and cons of becoming a spine surgeon?
So there are no cons of becoming a spine surgeon. So it's the best job in the world. So I came to spine surgery very early in my career. When I started my training at the orthopedic department here in Frankfurt, I was trained by Professor Kerschbaumer, who was the mentor of my doctoral thesis as well. And he was a very famous rheumatology surgeon at that time. And at that time, there were no much, let me say, medications which you can use for treating rheumatology patients. And so many of them had very significant problems with their joints. And one of the most important problems was that they had these retodental pannus, C1, C2 pannus with significant instability. And at that time, it was very common to perform a surgery, which is transoral spine surgery. So you remove the odontoid via the transoral approach and decompress the occipitocervical region via the front. And there were not too many people doing that, but one of the people who does that at that time in Germany was Professor Kerschbaumer. And so everybody came to his OR room and looked at the surgery which he performed. And I was a very young assistant and I was taking part in that surgery. And I was so fascinated that I said, I want to do that as well. And so still that is one of my preferred surgeries because it's very rare, it's very seldom, it's a quite risky surgery in a certain way. And so I liked that very much and was so fascinated by that type of surgery that I wanted to become a spine surgeon. And that even increased because, let me say, the spine surgery is quite a challenging topic. Yeah. You know, you can do a lot of things, you can make a lot of mistakes in spine surgery. And if you do a mistake, it has tremendous, let me say, tremendous problems for the patients. And so you have to be very careful, very soft, very gentle, and very precise. And that is very special because if you do a wrong drilling in the knee, nobody cares, in fact. But if you do a wrong drilling in the spine, the patient will never walk again. And that's the whole difference. And I like the challenges. And so that's the reason why I like spine surgery.
Great.
Great.
Yeah. And so you already talk about your professor that I think that is the figure that inspired you the most, but in your journey, there were also other figures that inspire you.
Yes, there were. In fact, my second boss was Norbert Haas, and Norbert Haas is a very big shot in the AO. You know, he was president of the AO, and he in fact connected me with the AO in the past. He was the first one who introduced me to the AO, and he was a very important guy in my life as well. He's a trauma surgeon, and he's one of the most famous trauma surgeons in Germany. That's the reason why I came to trauma surgery, in fact. And there's another one for spine. I never worked with him, but Jürgen Harms is also a very important guy. Most of you will know him, the Harms procedure in the upper cervical spine, for example. Exactly, the cages and so on. And I never worked with him, but I introduced my scientific work to him. And he was very interested in seeing that and talking with me. And we discussed a lot of things from the scientific part of view, from the scientific point of view. And so he supported my research very intensively. And I visited him several times in Karlsbad, Langensteinbach. He was working at that time. And so he influenced me also because he is a very, very handy surgeon and he did a lot of beautiful surgeries. And so I was very fascinated by him as well.
Great.
I just did like the Harms procedure on the cadaver last week in Utrecht, so I was training there. So it was very nice, and then very, like kind of a very satisfactory surgery. Of course, when there's a spinal infections and so on. I would like to ask Professor Kandziora. I reckon that you just work with maybe different systems, and taking into account that you have worked in maybe in the private and so the public. How would you say that like a different system can influence the work for spine surgeons, like a combining private and then the public system, or like just going on the private? What would you think about it?
So that's a very, very complicated question because national health systems differ tremendously from country to country. So there's always a tendency to, let me say, pick something from a health system to put it in another health system because it works very well on the one side and to try to introduce it to another system. But that typically does not work because these national health systems have typically a very, very long history. They are, let me say, incrementally growing. And so health systems differ dramatically. For example, in Germany, we do have, of course, private sector and public sector. But in my position, I can do both. So I do not have to go to another hospital to do private work. I just can do in my hospital private work, and I see private patients in my hospital. And that's a big plus, you know, because you do not have to change the hospital. You do not have to work in different environments. You always have the same people around you doing the same things, regardless if the patients are private or if they are not private. And that's a big plus. And that's one of the big pluses, I would say, on the German systems. But there are so many systems and they are so different. In generally, I think if you are forced as a surgeon to earn your money in the private system, that's not good, you know. So I think you should have enough income. If you just do public work, that's very important because that makes you independent. So you do not have to do an implant removal in a private patient, while somebody else does a complex osteotomy in a non-private case, you know. So you should be able, you should be put into a position where it doesn't really matter if the patient is private or non-private.
Yeah.
Professor, considering your professional experience and vast clinical experience you have, can you share us the most memorable case of your career and the things which you have learned from the case probably?
That's a very, very tough question because we do a lot of interesting cases, I would say.
I can confirm that.
Yeah, it's really a very, very, very tricky question. I can tell you my last impressive case was a chordoma C1, for example, with a spinal cord compression, so where we did a complete resection of the chordoma and the clipping of the vertebral artery, doing the complete resection and doing an occipitocervical stabilization. So that was one of the very interesting cases which we've done, I think, approximately 3 months ago, the last time. So there are many beautiful cases, and I think there is nearly in every case you can learn a little bit. So it's not the one special super case where you learned everything. So it is each and every case where you learn a little bit. That's important, I would say.
Sure. Thank you.
And another question, Professor, you are currently a faculty member of the AO Spine. For you, it is important for a spine surgeon to be a part of an academic community like AO Spine, and in which way the AO Spine influence your career?
Oh, first of all, AO Spine was very, very important for my career. So as I already mentioned, I was introduced by Norbert Haas, my former boss, to the AO, and I had different positions in the AO. I was part of the expert groups, the knowledge forums. I was part of the technical commission. That was always one of my favorite because the technical commission had in the past a lot of, let me say, developmental work for spinal implants to do. Together with the industrial partners, and that was always very interesting. That fascinated me. I was involved heavily in a couple of different implants, P, for example, cervical spine stabilization, USS fracture miss, Synfix lumbar, and so on and so on. Also, the most recent one was the Symphony and the Synapse systems in the past. So that were all systems which I was involved in the development, and that always fascinated me. Unfortunately, in the past time, I was not able to participate so much as an AO Spine faculty. That's due to the fact that I had a lot of administrative work to do in my hospital, and not only in my hospital, but also in my hospital chain. So I'm become a manager at a certain time point. I try to be 3 times a week in the OR, but I at least have one fully day with management. And so that's become very complicated for me to become involved in a lot of courses and events. But I think it's absolutely mandatory for a young spine surgeon who want to make a career that he's participating in research and in education. And the reason for that is very simple, because it's not only that you promote yourself, that's of course a nice side effect, but you predominantly learn. Each and every time you have to prepare a talk and you have to talk to your colleagues. You need to know more than your colleagues about the topic. Otherwise, it doesn't make sense. And so you have to learn, you have to read, you have to prepare yourself. And that is of tremendous help, because that gives you a tremendous amount of knowledge. AO Spine has another very important thing, and these are the knowledge forums. The knowledge forums are really a group of expert spine surgeons who support research. And that's a really good chance for the young surgeons, because they have wonderful, let me say, people which you can talk to, which will help you with your research, which will guide you in your research work. And so if you are interested, becoming involved in the knowledge forums is, of course, a very good option.
I guess you just answered my next question, Professor Kandziora, because I'm myself also a researcher and then did a PhD, especially in spine trauma. I have read your articles and your group and so on. I think that's a very important to underline, that the research should be the daily practice of a spine surgeon in order to develop the skills, develop the new methodology, like creating a new network. And I do totally agree. AO Spine is one of the forums that we can just establish this network. And I'm very proud of that. I'm just kind of a member of this Spine Youth Club recently. And we really learn from of course, our mentors and then the old generation. But we have to also probably kind of bring the flag to the next generation. And that's why it's important to do the research and then do the teaching probably every day. I totally agree with this thing. I think I'm going to give it to the next question to Gunnar, as you have already answered about this research question.
Maybe a comment, but I think it's not only research for us, for the surgeons. It's of course also research for the patients, because at the end of the day, we want to improve their treatment, and that's very important. And this is not only the research, it's also the education, because if you train younger surgeons to do a good job, that's of course also very helpful for the patients. That's the reason why we do all the things. Exactly. So at the end of the day, it's for the patients.
Yeah, Professor. Professor, coming back to your career, what is the achievement you are super proud of, or which you feel makes you feel great about yourself, maybe?
I would say my team, I have a very, very, let me say, super team. The people are nice. They are very clever. They are really good surgeons. A lot of them work for decades together with me. And so if somebody works for decades with you, he most of the time likes you, So in other words, I have a very, very nice team which works with me together for many years. So they are 100% reliable. They are smart. They are doing a great job. And that's really what I'm very proud of.
Yeah, that's a great answer, Professor. It's the teamwork that matters the most, right? Especially for spine surgeons.
Correct. Yeah.
And Professor, if you could turn back time, what advice would you give to the young you, and what would you have done differently?
What I have done differently, I would say nothing, because it worked out very nice for me. Okay, great. So I would give you the advice that you choose a specialty which makes you happy. If you choose a specialty that you are interested in, that you want to learn more about, which makes you happy, then you are satisfied and you're learning and try to improve constantly. And that's very important. So you have to be happy with your work, and then everything will work out.
I think we have been talking about all the spine surgery and then the career opportunities, but let's do some kind of a game that we're going to ask some fast questions and then expecting some faster answers. I would like to ask hobby or hobbies out of the spine surgery.
Oh, I'm a hobby archaeologist.
Okay.
In fact, I even study archaeology. I do that after 6 o'clock in the evening. You can do that here at the Frankfurt University, at the Goethe University. Unfortunately, I have not enough time to do that. But as soon as I finish my professional career, I will become an archaeologist.
Lovely, lovely.
Wow.
Yeah. Then you being a voracious reader, Professor, which is your favorite book?
The one I would read at the moment, I would say. It's an archaeology book, by the way. It's about Waldkirmes, which is an archaeology site just around the corner, which might be interesting for you as an Italian guy, because the Romans were here as well. And that's about a Roman excavation here in Germany.
Wow.
Okay.
And your favorite sport and team?
Oh, that's easy. Soccer, FC Bayern München.
Bayern München, yeah. But
I
about
grew up in
like
Bavaria,
yeah.
80
Yeah,
kilometers
I
away
can
from
understand.
Munich. So I grew up in Bayern München underwear, you know?
Yeah.
Cool. Do you have any like favorite surgeries when it's just like involve the spine? Maybe cervical, you already named it, or
Yeah,
other
so
places?
I would say the more complex, the more I like it.
Lovely, yeah. That's what we expected, right?
And with advanced technologies, there is navigation, robotics, and so many stuff coming in, Professor, in our field. What do you
Yep.
feel stands better, freehand or navigation and robotics? What's your take on that?
Both. I would say both. So there are indications or cases where you can do easy, let me say, a freehand pedicle screw placement, which is, if I do a L4, L5 TLIF, I think I've done that 5,000 times. I don't need navigation. But if I have a very complex case with a deteriorated anatomy, I use navigation as well. So it really depends on. I do not have many experience with robotics so far. I have seen a couple of cases, but we do not do that in our hospital.
Yeah.
And I think you're just gonna ask this open or MIS surgery, but you'll probably answer the same. It's just combination, right?
I would say both, yes. So it depends
Yeah,
on,
definitely.
so
Yeah.
there are good indications for endoscopic minimal invasive
Yeah.
discectomies, and there are good indications for minimal invasive microscopic discectomies. And of course, you can do torcoscopic surgery as well as open thoracotomy. It really depends on the case.
Great.
And one final question, Professor. What defines spine surgery to you, and what's your advice to the future, the younger generation, and what's your comment, or what do you want to pass to next generation regarding spine surgery, please? Yeah.
So it's a beautiful specialty. And if you're interested in spine, you should go for it.
Great. So thank you very much, Professor, to joining us today, and also for being a source of inspiration and motivation for young surgeons like us, but also for the whole community of AO Spine Yacht Club. It has been a truly privilege. So thank you very much.
Thank you very
Thank
much
you
for
very much,
inviting me,
yeah.
and hope to see you soon around the world on some conferences. Okay.
Yeah.